Hello, I am Brenda Johnson. I am the pharmacist and owner of Calabasas Pharmacy here in Gelson's Market, and I'm here today to address some of your questions and concerns about the new COVID vaccines. A lot of questions that I've been getting here in the pharmacy, I'm going to answer for you. The first one seems to be, was this vaccine rushed? How did we get this so quickly when usually it takes years to bring a new vaccine to market? There's a couple ways. First thing I want you to know is that none of the phases in the research and development were skipped. There are 4 phases to bring a new vaccine to market. The first is tested in about 100 patients, and that is for safety. They just want to make sure there's no problems with it. Then they move on to about 1,000 patients, and that is for efficacy. Does this generate an immune response? And the third phase are the big trials that you hear about. The Pfizer one had about 44,000 people. The Moderna had 30,000 people. Half got the vaccine, half got a placebo. So they need to compare, is there a better response and less disease in those who got the vaccine than those who got the placebo? Now we are actually in phase 4, and phase 4 is continued monitoring, continued research, ongoing to really make sure these vaccines are doing what they're supposed to do and not causing the public any harm. If none of the phases were skipped, how did this come out so quickly? First of all, the CDC and the FDA have made this a priority. Once the manufacturers submitted that information to the FDA, it went right to the top of the list. And it got reviewed, all the scientific literature, and then voted upon by them. Secondly, and most importantly, what really helped bring this to market quick is that the US government stepped in from the beginning and said, we are going to buy all these doses. Therefore, that took the risk out of the manufacturers. Usually a manufacturer will not start even manufacturing a vaccine until it is through phase 3 trials, because they don't want to invest all their money into making something that could be thrown out. Whereas the government said, don't worry about that, we're going to pay you. If it's not approved, you're still going to get your money. So therefore, that was the ongoing phase where they were manufacturing the vaccine while it was still in trials. Let's address now, what is mRNA technology? A lot of concerns out there, mRNA, DNA, does this get into my DNA? Is this going to change anything? Absolutely not. I love this description of mRNA the most. Think of mRNA stands for messenger RNA. It just carries the code. So to me, mRNA is like a recipe, okay? So when you're getting that vaccine, you're getting that injection into your arm, what you are putting into your muscles is the recipe for the little spike on the COVID vaccine. We've all seen what the coronavirus looks like. The round circle, and it's got the little spikes on the end. What the mRNA is the recipe for those little spikes. So that goes into your arm, goes into your cells, does not go into the nucleus, has nothing to do with DNA. Your little cells have the recipe, and then they start making those little spikes. And then they release those spikes out into your body. And then your body says, oh my gosh, what is this spike? I've never seen this before. I must defend myself against it. And that generates your immune response, and your body builds antibodies to attack those spikes. So now let's get into what side effects having that injection in your arm causes. Most importantly, or I would say most commonly, is the traditional sore arm you feel after any type of vaccine. However, in this one, it's pretty strong. You may be able to only lift your arm, say this far, and you can lift it further, but you're going ow, 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 because that is the vaccine in your arm working. The area might also be a little red. It might be warm to the touch. Some people with the Moderna vaccine have seen a strange side effect a week later, where this whole area gets red, itchy rash a week after when they've recovered, but then it goes away on its own. Absolutely not harmful, nothing to worry about, commonly seen now that we're in phase 4 and a lot of people are having this. But again, the sore arm is the most common. However, there are some systemic side effects in the body. Fever, fatigue, headache, maybe muscle aches, And those can really vary. Sometimes some people might be, yeah, I had a headache, I was a little tired the next day. Other people are like, oh my gosh, I felt like I had the flu for 24 hours. So that all depends on the person. Completely normal though, and most importantly, you recover within 24 to 48 hours. Supply is low and demand is high for the vaccine, so everybody wants it. They're projecting by late spring, early summer, that's going to shift and we're going to have ample supply to vaccinate anyone who wants it. My fear is that come summer, there's not going to be a lot of coronavirus going around anymore. The vaccinations are going to kick in. Everything we're doing with masking and distancing and less gathering and less holidays is going to kick in. The weather is going to warm up. As you all know, we did not, even though we were still living in fear of COVID over the summer, the cases were nowhere near what they've been these past few months. So what my fear as a pharmacist and vaccinator and professional is that in the summer, when there's plenty of vaccine around, people are going to be like, oh, I don't need that anymore. We beat COVID. It's over. It's done. It's in the past. It's in the history books, because we have very short-term memories. And then as we come into next fall, again, just as you get to cold and flu season, they've been seeing that the coronavirus is seasonal also. Once kids hopefully go back to school in the fall and people start gathering and going to football games, people are going to start getting sick. That's how it's been for years. Now, whether that illness is a cold, a flu, or more COVID, you're not going to know. And my feeling is that we're going to see increasing cases of COVID come back up next winter if everybody does not get vaccinated this summer. So please, when it is your turn, get the vaccine. It is very safe. I've had both doses. I am feeling much better about that. I did not have any serious side effects. What I had all resolved itself within 24 hours, and I would much rather have 24 hours of not feeling good as opposed to having COVID, having much longer time of not feeling good for like a week, and maybe possible potential complications down the line. Thank you very much, and get your vaccine.